they are definitely not mentally retarded kids. They are special
Not at all.
kids.
Yes, they are very special.
Yes. Samata, I have heard many times that people say ASD children do not understand anything, or they can't understand emotions, sense things. So just tell us more about it.
Correct. Yes, they have that emotional challenges. They are not able to exhibit appropriately. But I will not accept that they don't have emotions.
Yes.
Okay. See, I see my kids, they have taken treatment and they have gone out when they see me on the road or somewhere, they come and hug me. This is the best example of their emotions. But yes, they do have emotional breakdowns. They do have emotional dysregularizations. Those things can be corrected, of course, through the therapies, as the therapies are, because they are major challenges on their, perception ability. So, of course, the emotional challenges will be there, but it doesn't mean that they are not able to understand our pain. They will be able to understand our happiness. They know our anger, but only thing their way of exhibiting is in a different
It's
way.
different.
You
Yes.
know,
True.
yeah, but I will not agree that they don't have emotions. They show the best emotions, but we do have challenges on their emotional regularization.
So it
Because
is one
they
of the
are not able to.
misconception.
Yes, they are not able to express in their, or we are not able to understand what they are expressing in their own way. That is why I said we should go in their way. They
Go in
cannot
there.
come in our,
Yes. I think
we should
because
travel along with them.
yes, I think we are used to just one kind of a norm, seeing how everybody reacts in the same way. And if somebody is reacting in a different way, we just label out that person into some different category.
Eh,
Whereas it
Exactly.
shouldn't be like that. Just we should
Exactly.
make an extra
See,
effort to understand.
that extra effort is the missing.
Yes,
It's not, it's a small word. It is missing in our community. It is
it is
missing in our
missing.
society. It is missing around the people. So that understanding their emotions, we should also,
Yes.
the society has to improve in a way how we are going to understand their emotions and how we are going to give the space to understand that their emotions. A child gets excited when you get inside a party hall. The child may not resist to get inside the party hall. So we have to see why and for what the child is resisting to exhibit that emotions, why the child is crying or why the child is getting very happy to see that place. So that emotions has to be addressed appropriately. I feel if we think in their way, I think it's very easy to
Easy to
understand their emotions.
understand. And I think since you said ki ASD is increasing in India and it is becoming one of the norms, so I feel there's something needs to come in the education system now in these schools where more awareness about it has to come from the base levels, so that like coming generation and the present generation starts understanding that these children are part of the society. They're no
Yes,
different.
there's no difference. See, then, school learning is yes, how the child is going to be accepted in the
Yes,
given
this is the point. Yeah.
environment. But as a young parents,
Yes.
when the child is conceived or when the mother is conceived, from that time the education has to be started. How the importance of early intervention is very, very important. Even a small negligence, a child will start slowly not responding to amma, papa, or,
Mm-hmm.
not turning around for the name called response or the eye contact reduces. We should not wait for
Wait
that.
for
We
it.
should just
Yes,
seek the help. We have to start
absolutely.
seeking the help. That absolute right time is very much important in addressing this.
Okay. And that absolute timeline is between 18 months to 5 years.
18 to 5, but mostly you will be start seeing that slow declining of their response
Uh-huh.
at the early stages itself.
Okay.
16 months to 18 months. And
Okay.
from 18 months, you will be knowing,
Okay.
that
Okay.
the response is coming down. So that will be the very, very right age. That early intervention is the very, very right age
Okay.
where we can really minimize them.
So that's the key. The early intervention, the correct
Early
timing.
intervention.
And this, as you said, it can be minimized.
It can be for sure minimized or you can completely recover. See what happens when
Okay.
we do
Okay.
late diagnosis, they have
Uh-huh.
cognitive challenges, the perceptional challenges, their way
Okay.
of thinking, their way of, their thinking ability, their listening ability, or their
Hmm.
communication response, their
Okay.
emotions. All these challenges we will be having when it is a late
Late
diagnosis,
diagnosis.
apart from their motor challenges or the sensory challenges they have.
So, talking about the therapies and treatment, doctor, what are the therapies involved, especially in terms of their emotional responses or sensory input?
See, first thing is who is the right person to diagnose?
Okay.
Okay. See, that
Yes,
also
I
you
think
should
that is
understand,
the
is
most
it?
important thing, right?
Exactly. So, first is you will be visiting a developmental pediatrician, and the developmental pediatrician will refer to a psychologist.
Okay.
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 And then the psychologist will be doing the assessment and they will put them into the high risk. So when we see high risk is when they are during the age of 2 years. But when it comes above, yes, we can go with 5 years and above, we can go directly with the diagnosis.
True.
But what happens after that, we have to address the sensory motor challenges. See, sensory challenges is the child may not be comfortable for haircut, nail cut, or
Mm-hmm.
brushing. These are called as sensory challenges, tactile sensory challenges. Motor or a different sensory, they will not be sitting in one place, or they will be having a lot of flapping, stimming, and all. So these are called as sensory challenges. Along with the sensory challenges, they will be having a motor challenges. The child may not be able to wave, the child may not be able to write, ball throw, or open and close. All these are called as motor challenges, which has to be associated with their age limit. See, a 2-year-old child, I cannot say, okay, you have to go open a bottle. It will be difficult, or you
Mm-hmm.
can write. But a 2-year-old child can hold the crayons, you can see many houses, you can see the child will be scribbling on the wall. A 2-year-old child, so that age appropriate will be should be developed by the sensory motor therapist or occupational therapist or a physiotherapist who has been trained or certified for the sensory motor integration. So this will
Okay.
be the first therapy to address their sensory motor challenges. And
Uh-huh.
a cognitive behavior. Behavior is all the behavioral challenges the child is having.
Mm-hmm.
Cognitive is the level of learning ability, how the child is developing. This will be addressed by the psychologist and the speech therapist. So speech
Okay.
therapist is their receptive level and the expressive level, or their if they are having any chewing challenges. So many kids, what happens, they will chew the hard textures like chips or biscuits.
Mm-hmm.
They'll be able to chew and swallow, but when it comes into khichdi or sticky foods, they will not be able to chew. They will just swallow, or they may not like to eat. So I see many kids at the age of 6 or 7 also, parents will be giving the purified form of food.
Okay.
So
Okay.
these challenges will be addressed by the speech therapist, that is the orosensory, oromotor, and the receptive level and the expressive level languages will be addressed by the speech therapist, and their academic goals will be addressed by the academic goals, and their ADL trainings will be addressed by the special educators.
Okay.
So these are the different therapists,
So
regular
these are the
monitoring of
specialized therapies, professional therapies. Now,
exactly,
talking about the parents who have
exactly.
ASD children, so what kind of a training or counseling do they require, and whom they should reach to?
Yeah. So this is the very, very important aspect I feel in my experience, because you're going for therapy for few hours or few days,
Yes, true.
but a regular monitoring and a modified method of approach should be consistently given to parent. It's
Yes.
not one time training, okay?
Mm-hmm.
Because it's a developmental aspect. So in every stage, the parents has to be trained in all the aspects. Either it can be into the speech therapy or into the sensory motor.
Okay.
And
Uh-huh.
how, see, as a young parent, they will have their own level of emotional stress in
True.
handling these kids 24 by 7, because they have to
Mm-hmm.
modify. You cannot just like that go, if you want to go somewhere, you have to prepare the child somewhere if you have to go. So they will also be having a lot of emotional stress. So first we have to counsel them how they will be able to handle the child appropriately, because
Sure.
they are also going to replicate as a layman, they are going to replicate as a therapist, is it?
Mm-hmm.
So
Mm-hmm.
They have to be trained continuously and are monitored with their home programs. We call it as a home programs or a
Okay.
home based therapies,
Okay.
which will be modified according to home. See, for example, a child who is not having a tolerance, okay, I'm going to put them in a lot of weight bearing activities. I can modify that activity into a simple water pouring to the pot, or just give him a wet towel, ask him to wipe for the table, something, a modified method of learning, which
Okay.
will also help to improve their daily living, so that parents dependencies will come down. So a continual monitoring of the home programs and the home based training and the home therapy is pretty much or a very much mandatory if any child is diagnosed in any form of neurodevelopmental disorder.
That is true. And that is why we say ki family support is very much required for the parents, because it's the parents who are
Exactly.
directly dealing with it.
Parents, and if they are having grandparents at home,
Yes, true, true.
they should
All
also be trained.
they should be also trained, right?
There is a
So
yes, there should be a yes. No is no for them.
true. We have to understand that part.
Exactly.
Yeah. So coming to my last question, doctor, what advice would you give to the parents who are just beginning to suspect that their child might be on the spectrum?
Maybe it's just the time. Don't wait for a day to. I say each and every day, every minute is very, very important. When a child, you see any one small changes in the child, just go to a developmental pediatrician
True.
and take the advice of them. Don't delay. You see, nothing is going to harm us for having us to put us into the second opinion. And if that intervention has to be given, don't delay it. Start instead of doing a lot of researches. Just start it and see whether if your child is responding, then it's a biggest milestone or the biggest
Yes.
gift you give to the child.
Yes. Because as you
You know,
said, this can come, early intervention can lead to minimization, or the child can recover also.
exactly. That's
Absolutely.
true.
Yeah. Thank you so much, Dr. Sumitha, for such an insightful session. Thank you so much for joining us.
Thank you so much for having me.
Thank you, Doctor, for such an insightful session. I'm sure after listening to you, our audience is now aware of many myths and misconceptions about autism, especially that a child with autism spectrum disorder is not mentally disabled. So to all our audience, the next time you meet a child with ASD, don't respond with pity or hesitation. Instead, approach them with understanding and respect. And for all the parents and caregivers who want to reach out to Dr. Sumitha for advice or treatment, her contact details are provided in our caption. This is your host, Ankur R Gupta, now signing off. फिर मिलेंगे एक और राइजिंग स्टार की कहानी के साथ शी स्क्वाड तेजस्विनी पर।